Localization of thoracic limb lameness can be very challenging. It is important to develop a routine where the major joints and the cervical spine are palpated thoroughly. Particularly in the case of shoulder and elbow, it is important to start the examination with your patient standing, equally, well balanced, with appropriate weight on both legs. By running your hands along the spinatus muscles, it is possible to feel for atrophy in the supraspinatus, atrophy in the infraspinatus and associated muscle groups, to determine if disuse or neurogenic atrophy is present. Continuing to run your hands down the brachium, feeling the tricep muscles, the bicep muscles, and then running down onto the forearm allows you to get a feel for the degree of muscular development and inequity between the sides. When palpating the shoulder, I'll normally commence with shoulder extension. Full extension should be possible, and by placing the joint in this fully extended position, we're looking for signs of discomfort and or loss of range of motion. By then rotating the shoulder back into a flex position allows you to determine the presence of supraspinatus discomfort. This can be exacerbated by external rotation. If pain is found, one should be careful not to repeat the process unduly. When then placing the limb in a flex position, it's possible to extend the elbow at the same time and palpate for the bicep tendon. In this patient, you can see there is shoulder discomfort and trepidation in the rotator cuff and to a minor degree in the bicep tendon area. When palpating the elbow, it's very important to palpate the joint in a standing position and determine if effusion is present. Fusion can be palpated in the lateral compartment underneath the anconeus muscle. Bulging, soft, fluctuant area here indicates that there is fluid within the elbow joint. Also, it's important to feel for lateral compartment thickening, which is a combination of fibrosis and osteophytes in some patients. When palpating the elbow, it's wise to support the brachium, check full flexion, full extension, and then work the elbow through a range of both supination and pronation. It's very helpful to determine medial compartment pain when neutral flexion is compared to pronated flexion. Pronated flexion will cause discomfort in the medial compartment through a combination of coronoid compression and, in some cases, flexor tendon stretching. Being vigorous in the extension motion also allows you to get a feel for how well that joint slides into position, and full extension will test the back of the joint where the anconeus runs into the supratrochlear foramen. Palpation of the extensor muscles and tendons from the lateral epicondyle and the medial flexor tendon bellies from the medial epicondyle is also helpful.